Hello everybody, my name is Jo Moss. I'm the Director of Strategy at Moorfields Eye Hospital. Ordinarily we'd be meeting with you in person today and I'm sorry that we can't do that, but I am delighted that we still have the opportunity to introduce you to Oriel, which is a joint programme between Moorfields Eye Hospital, the Ucl Institute of Ophthalmology and Moorfields Eye Charity. And together we hope to create and build in Camden a brand new integrated centre for the provision of eye care, eye research and eye education.
My name is Andrew Dick and I'm the Director of UCL's Institute of Ophthalmology and also the Duke Elder Chair of Ophthalmology at UCL. I'm a non-executive director on the board for Moorfields Eye Hospital, and we are keen to hear your thoughts on views on the early designs of this new building and what you would like us to take into account as we continue to develop those plans over the coming months. At the end of the film, I'll explain how you can do this. As mentioned previously, this project is a partnership between three organisations. Moorfields Eye Hospital NHS Foundation Trust is the leading provider of eye health services in the UK and a world-class centre of excellence for ophthalmic research and education. Ucl Institute of Ophthalmology is a world-class institute that is an expert in discovery science, biology, and understanding of cell and gene function related to visual health and disease. The institute are pioneers in the development of therapies and diagnostics that support eye care. Moorfields Eye Charity is the main fundraising and grant-making charity for Moorfields Eye Hospital and the UCL Institute of Ophthalmology. The charity provides targeted funds to research cures and find treatments for millions of people affected by eye disease in the UK and around the world. The number of people likely to be diagnosed with common eye conditions such as cataracts, glaucoma, macular degeneration and diabetic eye disease is expected to rise exponentially and rapidly over the next 15 years. Our ageing population means greater and more complex demand for eye services, as almost 80% of people aged 64 and over live with some form of sight loss. The economic cost to the UK of vision loss is estimated at more than £15.8 billion per year. As such, developing and delivering therapies for eye conditions is an important challenge for the UK and globally. We need to plan for the future. The closer clinicians and researchers work, the faster they can develop new techniques and technologies to create new diagnostics, new therapies, to be able to diagnose and treat conditions for the benefit of our patients and society. Moorfields Eye Hospital and UCL Institute of Ophthalmology currently share a site on City Road and Bath Street in Islington. Those facilities are outdated and do not provide an environment for the best patient or staff experience, nor does the estate allow us, as scientists and clinicians, to work seamlessly as we have to work across several buildings. We are increasingly constrained by our current estate.
Our vision is for a modern, new, integrated eye care, research and education facility, bringing together the existing expertise of the partners under one roof. This will enable closer collaboration to transform the future of eye care for the benefit of patients, carers, health professionals, researchers and students. The relocation of NHS services to a purpose-built centre will provide patients with an improved patient experience, better access to counselling services and patient support groups, and improved care pathways. A more collaborative working environment will enable our translational bench-to-bedside research. This means that with clinicians and researchers working closer together, we will be able to increase the scale and speed of progress from scientific discovery to clinical practice, improving clinical outcomes for patients.
The 5-acre site at St Pancras Hospital is currently owned by Camden and Islington NHS Foundation Trust. The existing mental health inpatient wards currently located at St Pancras Hospital are planned to move to a new, purpose-built facility next to the existing Highgate Mental Health Centre and the Whittington Hospital. The St Pancras site provides us with an excellent location. It's ideally situated close to the UCL Bloomsbury campus, where researchers can interact with other biomedical researchers, and our clinicians will be closer to our other hospital partners. The new centre will be within London Knowledge Quarter, an area which has one of the highest densities of knowledge-based, cultural and scientific businesses anywhere in the world. These include Francis Crick Institute and the Wellcome Trust, both of whom we already have close working relationships with, but we wish to foster that more. The new location is close to 3 mainline railway stations, as well as to 6 London Underground lines and the Overground. We are also conducting another piece of work on people's journeys to the proposed centre. Our lead architects from Penoya and Prasad will now explain our plans in more detail.
Hello, I'm Sunand Prasad of Penoya and Prasad, the lead architects for Oriel, part of the ACOM team. The neighbourhood around our proposed new building is seeing considerable change and is part of a designated regeneration area. The St Pancras Hospital site covers 5 acres. We are proposing to develop 2 acres of this for Oriel, located on the corner of St Pancras Way and Granary Street. The remainder of the site will be developed by Camden and Islington NHS Foundation Trust's development partner, the King's Cross Central Limited Partnership, or KCCLP. We are working with KCCLP to ensure a coordinated urban design approach to ensure that the 2 schemes knit seamlessly together. The St Pancras Hospital site is currently surrounded by a high brick wall impervious to public. The new development and the surrounding master plan, in contrast, will open up the site to become an accessible and welcoming pedestrian-friendly piece of the city. The St Pancras Hospital site sits within the King's Cross St Pancras Conservation Area. It comprises of a range of different historic buildings, Victorian workhouses, post-war architecture, and more contemporary structures. The proposed new centre has been designed as an open and welcoming environment with a highly innovative and flexible layout. This plan shows our vision for the public spaces around our proposed new centre, including key points of entry from both St Pancras Way and Granary Street. New public squares are proposed on the southwest and northeast of the building to be enlivened with cafe-restaurant seating. The plan also provides an indicative illustration for the layout of KCCLP's development, showing how the rest of the site could be developed. The KCCLP scheme is shown for illustrative purposes only and will be subject to separate consultation in due course. Now let us move on to the design elements of the proposed integrated eye care centre itself. There are 2 boomerang-shaped wings of the building that are organised around a spacious central atrium. The atrium will bring natural light into the clinical, research, education and social spaces within the wings. In the middle of the atrium rise the lift and stairs to all floors, and the landings at each floor level are large enough to accommodate spaces for patients to wait, staff to meet, study and collaborate. Everyone will pass through this mini tower that has come to be called the Oriel. The design of the atrium is being carefully developed to ensure comfort for people with a variety of visual abilities and disabilities, gentle glare-free light, excellent acoustics to minimise noise, good air quality and ease of wayfinding. The building will host a wide range of different functions: outpatient services, day surgery and recovery areas with a small number of inpatient beds, the accident and emergency department, laboratories and associated spaces for research, facilities for clinical trials, patient support services, education spaces, and administration rooms. Although no standard parking will be provided on site, a dedicated patient drop-off and pick-up bay runs adjacent to St Pancras Way. Disabled parking spaces will be provided as part of the overall development. The building ranges in height from 7 to 10 stories above pavement level. The varied heights relate to the different scales of the surrounding buildings, as well as to St Pancras Gardens. The new building will respond to this varied townscape by being lower towards the southwest and rising up towards the northeast. The facade of the building has been designed to bring a human scale and warmth to what is quite a large structure. At the same time, it is as energy efficient and durable as we could make it. The facade pattern and reflectivity have been considered for impact on visually impaired people. We are excited to be presenting our plans to you. We hope they will provide many benefits to the local community as well as to people with sight loss. There will be a world-leading integrated eye care, education and research centre in Camden, adding to its unique knowledge quarter, one that will attract, inspire and retain the most talented clinicians, researchers and educators. It will speed up the development of new research and treatments and, most importantly, engage with the public on this mission. The building is part of creating a new St Pancras neighbourhood with a vibrant public realm and greater access around the site. Active ground floor uses and natural surveillance will bring new life into this area, limiting crime and antisocial behaviour and promoting health and well-being. Camden will have an exemplar of design for the post-fossil fuel age with world-class architecture.
So thank you very much for joining us today. We are really keen to hear your feedback on our plans. Once we've collated all the feedback that you provide us, it will help us in shaping the more detailed development of the design of our proposed new building. Once we've been able to take on board all of the feedback and finalise our designs, we are hoping to submit a planning application to the London Borough of Camden during the autumn of this year.
Please share your feedback with us using the following methods. Email us at oriel@londoncommunications.co.uk. Visit our website on oriel-london.org.uk or free phone us on 0800 307 7967 or write to us using our free post address, free post RTZX-GRSR-BLXR. Thank you.